Hi there. Do you suffer from tingling in your hand, weakness in your grip strength? Are you dropping things? Are you waking up in the middle of the night to shake your hand to get the sensation back? If you do, you may be suffering from carpal tunnel syndrome. Hi there. My name is Dr. Stuart Yoss of Bannockburn Chiropractic and Physical Therapy, and today we're going to talk about carpal tunnel syndrome, the most common peripheral nerve entrapment out there in the world. The carpal tunnel is actually in your wrist and is formed by the flexor retinaculum, a band of tissue that goes around the wrist. Underneath that travels 9 tendons and 1 nerve. That nerve is the median nerve. The median nerve goes to the first 3 fingers on your hand. Some of the symptoms that you may see with carpal tunnel syndrome is, again, tingling, or you may even get weakness due to atrophy in this group of muscles in your thumb called the thenar muscles. Some of the more common causes of carpal tunnel syndrome are repetitive exposure to vibration. So very common with construction workers who are using a jackhammer or things that are causing high repetition. It could be due to pregnancy, due to the increase in water retention that we have, decreases the volume and decreases the amount of space that you have in your wrist. Poor work ergonomics. That's probably one of the more common symptoms that we see in our office from patients who are at a keyboard working for long periods of time and doing repetitive keystrokes. Perhaps something like rheumatoid arthritis or osteoarthritis. Even gout can be a common cause of carpal tunnel syndrome. Anything that's going to decrease the space and cause constriction and pressure onto that median nerve is going to cause some of the more common symptoms that we see. Commonly, like I mentioned, are tingling in the first 3 fingers, weakness in your grip strength, even some decrease in the size of this muscle, the thenar muscles. So those are some of the common signs and symptoms and causes that we see with carpal tunnel syndrome. When looking for carpal tunnel syndrome and trying to diagnose it, we have to rule out other areas that can be involved. The more common areas are the neck and having a nerve irritation from a disc herniation or a disc bulge. The nerve can also get irritated in the neck on the side and even through this area called the thoracic outlet syndrome. Something that we see as well, not as often, is a muscle in the middle of the forearm called the pronator teres. The nerve, the median nerve, passes right through that muscle, and that can reproduce some of those symptoms that are going to be down in the hand. So those are some of the common areas that can also produce symptoms in the hand. The way that we go about trying to rule some of that out is mostly through our clinical evaluation. There's certain orthopedic checks that we can do by having you put your hands like this, and that could create the numbness because you're really tensioning out that nerve. And also just coming in here and tapping where that carpal tunnel syndrome is. And if that creates that tingling, again, that could be a positive sign. If need be, we can have to do further diagnostic testing, something called an EMG, an electromyograph, or an NCV, nerve conduction velocity, where we stick electrodes at different points of your arm and we send a current from one point to the other. If there's a decrease in the speed of the signal or even the height of the signal, that will be indicative of carpal tunnel syndrome or a radiculopathy from the neck, so we can kind of rule it out that way. Worst comes to worst, we can also involve some either further diagnostic imaging like x-rays and MRIs to see what the discs and the area in the wrist looks like. So those are some other common ways that we can evaluate and separate out for carpal tunnel syndrome. In conclusion, if you're complaining of weakness in your muscle strength, tingling in your hand, feels like your arm is falling asleep, that could be carpal tunnel syndrome. So visit our website at bandchiro.com. Feel free to give us a call for an evaluation at 847-236-1194, or feel free to email me at stuart@bandchiro.com. Thank you, and we look forward to hearing from you.